Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. And for the best OET coaching, that's the number. And if you have any doubt regarding OET, you can leave the comment in the comment box. So we'll definitely reply you. So today we are trying to do this speaking task, which is the original OET sample test, nursing. So there would be two. So the task, when it comes to you, you will be getting only this task. So being a nurse, you will receive only this task. So you have to go through the settings कि children hospital में हैं. So you are basically working as a nurse in a hospital. You see the parent of a 3-year-old girl who has been brought to the emergency department because she has chest tightness, wheezing, and difficulty in the breathing. So you try to assess the situation कि छोटा 3 साल का बच्चा है. She is a 3-year-old girl having chest tightness, wheezing, difficulty breathing. You are assessing her in a triage and have just taken her vital signs. So you have already taken the vital sign. The child is not present for the discussion. तो बच्चा वहां पे नहीं है. You are talking to the parent. So you can well understand the situation. जब भी ऐसी situation होती है, so speak in this way always. So I'm just going to write it down for you. Or in exam also you are allowed to write. You will get 3 minutes to prepare. तो इन 3 मिनट्स में आप अपने टास्क पे कुछ भी लिख सकते हैं. जैसे इस पर्टिकुलर केस में अगर मुझे कुछ लिखना हो तो फर्स्ट लाइन आई वुड ऑलवेज लाइक टू राइट, क्योंकि फर्स्ट लाइन इज द मोस्ट डिफिकल्ट लाइन बिकॉज व्हेन यू आर इन द स्पीकिंग मोड, सो व्हाट हैपेंस इन एग्जाम, वी आर वेरी पर्टिकुलर अबाउट अवर थिंग्स. तो हम भूल जाते हैं फर्स्ट लाइन को, और फर्स्ट लाइन ही सबसे ज्यादा एंशियस करती है. सो वी हैव टू मेक श्योर दैट वी डू नॉट गेट एंशियस. सो वी स्पीक द फर्स्ट लाइन. गुड मॉर्निंग, माय नेम इज बीकेएम, आई एम अ नर्स हियर. सबसे पहले ये लाइन बोलिए, आई एम अ नर्स हियर. नाउ द बेस्ट वे ऑफ स्पीकिंग इज दैट कि आप उसको बताओ कि आई हैव सीन, दिस इज प्रेजेंट परफेक्ट, कि मैं देख चुकी हूँ. प्रेजेंट परफेक्ट का मतलब ये काम हो चुका है. आई हैव सीन योर डॉटर एंड आई हैव जस्ट कलेक्टेड हर वाइटल्स. तो यहाँ से आई हैव जस्ट टेकन हर वाइटल्स. सो यहाँ से आपको वो लाइन बोलनी चाहिए जो आपको दिख रही है, आई हैव जस्ट टेकन हर वाइटल्स. अब आपका टास्क के जो मार्क्स मिलते हैं वो इसके मिलते हैं. So find out more information about children's symptoms. I've taken her vitals. So I would like to know more about her. More about her symptoms. So that is how you should start your task according to the situation. In this situation, I think this is the most appropriate way I could ask the parent. So ये आपको लिखना चाहिए पेपर में. You should write in the exam. So good morning, my name is BKM. I am a nurse here. I have seen your daughter and I have just taken her vitals. So I would like to know more about her symptoms. May I? So that is what you say. May I? So ये लाइन आपको हमेशा लिखनी चाहिए एग्जाम में, चाहे आप कितना ही अच्छी स्पीकिंग करते हो, आप कितने ही कॉन्फिडेंट हो. द फर्स्ट लाइन सेट्स अप द टोन. तो ऑलवेज राइट. फाइंड आउट मोर अबाउट इंफॉर्मेशन अबाउट चाइल्ड सिम्टम्स. तो अब आप उससे पूछोगे सो मे आई, तो वो कहेगा यस ऑफ कोर्स. सो सबसे पहले ही पूछो कुड यू प्लीज टेल मी व्हाट हैपेंड. ये आपकी स्पीकिंग को और आसान कर देगा. कुड यू प्लीज टेल मी व्हाट हैपेंड. सो देन पेरेंट विल एक्सप्लेन यू that actually what happened is that my girl had a sudden attack and she was having chest tightness, wheezing, and difficulty in the breathing. So I brought her directly to the emergency department. Okay, so I would like to ask you, yeah, so I would like to know, could you please tell me. So then you will ask, तो second पूछने का तरीका होता है could you please tell me. ये दो words आपको आने चाहिए. Could you please tell me, ये लाइन जैसे आपने पूछा. सो कुड यू प्लीज टेल मी अबाउट द ड्यूरेशन ऑफ सिम्टम्स. अब आपका टास्क इजीली चलेगा. ड्यूरेशन ऑफ सिम्टम्स. सो देन पेरेंट विल से यू नो इट लास्टेड फॉर एन आवर, 1 घंटा तक चला वो सिम्टम्स एंड दिस एंड दैट हैपेंड. देन यू विल आस्क हैव यू नोटिस्ड. दिस इज प्रेजेंट परफेक्ट टेंस. सो प्रेजेंट परफेक्ट टेंस बहुत ज्यादा यूज होता है क्वेश्चन पूछते टाइम. हैव यू नोटिस्ड, तो ये भी आपको सीखना है. सो हैव यू नोटिस्ड. Yes. So have you noticed any triggering factors? So the parent will say See, there are no triggering factors I have noticed. It's just she was running and all of a sudden she had an attack of chest tightness, wheezing and difficulty. Okay, could you please tell me about severity? How severe was it? Could you please tell me about severity? तो ये क्वेश्चन आप साथ साथ लिख सकते हो, पेपर में इतना टाइम नहीं मिलता आपको, लेकिन अगेन जब मैं आपको सिखा रहा हूँ तो मैं टाइम ले रहा हूँ, लास्ट में मैं आपको बोल के दिखाऊंगा, इट विल नॉट टेक मच टाइम. So could you please tell me about the severity of the symptoms? How severe were they? So parent will tell, it was very severe, just an hour ago, she could not breathe, she could not do anything, she was having, okay. So did you give her any medication? या हैव यू गिवन हर एनी मेडिकेशन? अगर आप हैव में ही पसंद करते हो तो प्रेजेंट परफेक्ट में चलाओ. सो हैव यू गिवन हर एनी मेडिकेशन? सो ये क्वेश्चंस, जब भी क्वेश्चंस होते हैं इनको पेपर में लिखना चाहिए, बिकॉज क्वेश्चंस पूछना या तो आपकी इंग्लिश बहुत ही स्ट्रांग होनी चाहिए, अगर आपकी इंग्लिश स्ट्रांग नहीं है तो आपको इस टाइम को यूज करना चाहिए. हैव यू गिवन एनी मेडिकेशन? आर देयर एनी प्रीवियस अकरेंसेस? पहले भी कभी हुआ है? ठीक है. सो ऑल रेडी, सो आई एम रेडी विद दिस टास्क. फिर एक्सप्लोर फर्दर रेलेवेंट डिटेल्स. नाउ आई वुड लाइक टू आस्क यू some other details. How is her general health? Are there any recent illnesses? Any medications that she is taking? तो वो पेरेंट बताता रहेगा no no general health is good, there is no illness, she is not taking any medication. Then you will say, do you have any family history? Do you have, या does she have? अगर आप थर्ड पर्सन से बात कर रहे हो तो does she have आपको बहुत सारे मार्क्स देगा, क्योंकि she के साथ does लगता है, तो इससे भी एग्जामिनर को पता लगता है कि आपकी इंग्लिश कितनी स्ट्रॉन्ग है. So does she have एनी फैमिली हिस्ट्री ऑफ एज्मा? जो भी आपको वर्ड दे रखे हैं. सो जिसको हम अस्थमा बोलते हैं, वैसे इसकी सही प्रोनाउंसिएशन होती है एज्मा. सो एज्मा, हे फीवर और एक्जिमा. सो आप ये वाला भी क्वेश्चन पेरेंट्स से पूछ लोगे. सो दैट इज हाउ द टास्क विल गो. अब आपके ये क्वेश्चन राउंड खत्म हो गया है. सो अब आप बताओगे, नाउ आई वुड लाइक टू टेल यू अबाउट द एग्जामिनेशन फाइंडिंग्स. The condition is stable now. All the vital signs are normal. She is just having mild wheeze. Otherwise, there is no cause, no other concerns. So she is absolutely normal now, except she is having some mild wheeze. So parent कहेगा, thank you very much, आपको बताने के लिए that my daughter is fine. So then you say, now I would like to outline the next steps. बस सिंपल यही चलता है, दो वर्ड्स, could you please tell me and I would like to. ये बहुत अच्छे दो फ्रेजेस हैं, ये आपको बहुत हेल्प करते हैं ओईटी में. I would like to outline few next steps. First of all, अब सब कुछ विल में चलेगा कि डॉक्टर आएंगे, डॉक्टर ये करेंगे, फ्यूचर. So doctor will come and he will assess your daughter, and also he will let you know about further investigations or tests if needed, and then he will make an initial diagnosis and also will discuss about treatment. So will के साथ first form दोबारा बोल के दिखाता हूँ. So he will come and will assess your child. He will tell you about the possible need for the further investigation and will make an initial diagnosis and will further discuss the treatment options after the diagnosis. So is it fine? Are you understanding my point? अब छोटी सी बात, ये वाला पॉइंट बहुत अच्छा होता है कि पेशेंट से पूछना, आर यू अंडरस्टैंडिंग माई पॉइंट. इन चीजों के ही पॉइंट्स हैं ओईटी में कि आप पेरेंट को कैसे सेटिस्फाई करते हो और आप उनको अच्छे समझाते हो या नहीं. सो आपने पूछा, आर यू अंडरस्टैंडिंग माई पॉइंट, तो कहेगा यस, बट डू यू थिंक इट इज एज्मा, बिकॉज एज आई हैव टोल्ड यू हर मदर हैड एज्मा इन चाइल्डहुड, सो डू यू थिंक शी इज ऑल्सो हैविंग एज्मा? तो आप कहोगे, सी इट इज नॉट योर रोल. ये थोड़ा सा इन्होंने ऑफेंडिंग दे रखा है, तो इतना पेशेंट को हम ऐसे नहीं बोल सकते. सो प्लीज, इट इज नॉट आवर जॉब टू डायग्नोज, सो प्लीज लेट द डॉक्टर कम, he will do the diagnosis. But yes, there are some symptoms which are consistent with asthma, but doctor can only make the diagnosis. So please do not do that. And also at an early age, it is very difficult to detect asthma. So please do not diagnose yourself, wait for the doctor. So do you have any other concerns? तो पे आपको और कोई concerns हैं till the time we are waiting for the doctor? तो कहेगा, how much time would it take? So you say it is not too busy and there are number of doctors which are available. So your daughter is going to be seen very soon. So please don't worry. And she will have a good examination with the doctor, and doctor will quickly prescribe if salbutamol inhaler is required. So please don't worry about your daughter's situation. She is just having mild wheezing. Otherwise, all the vitals are normal and she is stable. तो दोबारा से उसको reassure करो कि सब कुछ ठीक है. So do I have your कंसेंट, यहाँ पे लिखा है एस्टेब्लिश पेरेंट कंसेंट टू रिटर्न टू वेटिंग रूम, सो इज इट ओके? ये वाले पॉइंट बोलने की जरूरत नहीं है, वो अपने आप चला जाएगा। अगर आपको बोलना है तो आप ऐसा बोल सकते हो, सो वुड यू लाइक टू गो बैक टू द वेटिंग रूम एंड वेट फॉर द डॉक्टर? तो वो कहेगा ठीक है, आई एम वेटिंग फॉर द डॉक्टर। फिर उसको ना रीएश्योर जरूर करो, सो इज इट ओके दैट यू कैन गो बैक टू वेटिंग रूम एंड कैन वेट फॉर द डॉक्टर? सो बेसिकली सीक्वेंस में चलना है एंड एवरीथिंग विल बी फाइन। ज्यादा स्ट्रेस नहीं लेना है और अपने टास्क को अच्छे से बोलना है। तो अगर आप इतना लिख सकते हो, देखो मैंने आपको सिखाने के लिए इतना टाइम लिया, लेकिन इतना सारा नहीं लिखा है कि 3 मिनट्स में नहीं लिखा जाए। अगर आप क्लियर साफ साफ ऐसा लिखोगे और लास्ट में रीएश्योर करना है, आई रीएश्योर यू देयर इज नथिंग टू वरी एट द मोमेंट एंड डॉक्टर इज ऑन हिज वे। आई रीएश्योर यू दैट देयर इज नथिंग टू वरी एंड डॉक्टर इज ऑन हिज वे। ये लाइन बहुत जरूरी है। हमेशा कभी भी टॉपिक को इसके बिना खत्म नहीं करना, that there is nothing to worry and doctor is on his way। ठीक है? या फिर अगर इस पर्टिकुलर केस में डॉक्टर शायद ऑन हिज वे नहीं है, सो ऐसा कह दो देयर इज नथिंग टू वरी एंड आई विल कॉल यू एज सुन एज द डॉक्टर बिकम्स अवेलेबल। सो सिचुएशन के हिसाब से असेस करना है, एज सुन एज डॉक्टर बिकम्स अवेलेबल। सो ये आपका टास्क पूरा रेडी हो चुका है। अब सोचो आपको ऐसा टास्क आपने लिख लिया है, तो अब देखना आपको ये सारे पॉइंट्स पढ़ने की भी जरूरत नहीं पड़ेगी। आप कितने आराम से चलोगे, अब मैं आपको फाइनली बोल के दिखाता हूँ एंड आराम से टाइम भी बीतेगा। गुड मॉर्निंग, माय नेम इज डॉक्टर बीकेएम, सॉरी आई एम अ नर्स। गुड मॉर्निंग, माय नेम इज बीकेएम, आई एम अ nurse over here. I have seen your daughter. I have just and also I have taken her vitals. So now I would like to gain some more information about her symptoms. So could you please tell me what happened? Well, nurse, I don't know. She was playing in the garden. Everything was fine. All of a sudden, she had a sudden attack of chest tightness, wheezing, and she started to have difficulty in breathing. Okay, I'm really sorry to hear that. But could you please tell me any possible trigger that you might have noticed? Well, nurse, as such, there is no trigger except she's running. Okay. So, are there any changes in severity? Like, how severe were the symptoms? Well, she was having a very terrible time. Nurse, she could not breathe at all, and she was having a very tough time. Okay. So in that case, did you give her any treatment? Well, no, nurse, I did not give any treatment. I thought that doctor is the right person to give treatment. That's very good. You have thought very nicely, and it is a good thought that only doctor should provide the medications. So you have done very well that you brought your daughter to the hospital. So are there any kind of previous occurrences of such kind of, incident? Well, no, nurse, as such, there is nothing. Okay. So may I ask you some more questions if you do not mind? Of course, nurse, you can. Okay. So could you please tell me about her general health? Like how has been her general health? Well, it's all good. Are there any kind of recent illnesses? No, not at all. Is she taking any other medication? No. Okay. Does she have any family history of asthma, hay fever, or eczema? Yes, nurse. Her mother is having childhood asthma, but right now she is absolutely normal. But in childhood, she had that complaint of childhood asthma. Apart from this, I don't think so there is any family history of asthma, hay fever, or eczema. Okay, thank you for giving me this information. Now I would like to tell you about the examination finding. Your daughter is currently stable. Her condition is stable. All the vital signs are normal. She is just having the mild wheeze and there is no cause for concern. So there is no other cause of concern. So you don't have to worry about your daughter. She is absolutely fine. Apart from this, I would also like to outline next steps. Like now doctor will come and he will assess your daughter. He will tell you about any possible need for any kind of investigations if required. And also he will make an initial diagnosis and will discuss about the treatment options. Is that okay? Well, yes, nurse, then where is doctor? See, I'm already scared about my daughter. Please call the doctor immediately. And is she suffering from asthma? Well, I'm sorry to say, but you should not make the diagnosis yourself, and it might be, it might not be. So only doctor can make the right diagnosis. So I have already informed the doctor. So he will be calling you soon. Is that okay? And also at this young age, it is very difficult to diagnose asthma. So only doctor can do that. So please don't worry about anything. So do you have any other concerns that I can answer you? Well, no, nurse, is just about doctors, like when would he be available? See, today we are not very busy and there are a number of doctors which are available. So as soon as the doctor becomes available, they are going to see your daughter immediately. They will do the quick examination And also if salbutamol inhaler would be required, they will prescribe one. Is that okay? Well, all right, nurse, but I'm really scared. Please don't get scared. I understand that being a parent, you are concerned about your daughter, which is absolutely normal. So we all are here to help you and we assure you for the best services. Okay? Well, okay, nurse. Okay, so is it okay that you can move back to the waiting room and can wait for the doctor? Yes, nurse, that's fine. Okay. I reassure you that there is nothing to worry. Your daughter is absolutely stable at the moment. It's just she's having bit of mild wheeze and doctor has already been informed, so they will be calling you as soon as they are available. All right, okay, then take care. That's it. That is how you do your OET task in a very nice flow. So you read, you if you write all these questions, they make your task very easy. So please try to write all these questions. And जो पेशेंट टास्क होता है वो आपको मिलता नहीं है, लेकिन मैं फिर भी आज आपको पढ़ाना चाहता हूँ कि आपको वहां पे जो भी एग्जामिनर मिलेंगे उनको भी एक टास्क मिला हुआ है. So they will tell you she has had wheezing, difficulty in breathing about an hour, running around in the garden. Symptoms are less severe now than when they started. You haven't given her any medications. You were not sure what to give. She's never had anything like this before. तो ये सब टास्क उसको दे रखा है. तो आपको बस अपने टास्क को कैरी करना होता है. वो आपको ये भी बताएगा my daughter is generally healthy, she has not been ill recently, she is not taking any medication, your spouse had asthma as a child but you do not think anyone else in the family has had hay fever or eczema. तो यही सब बातें मैंने आपको पेशेंट की बोल के दिखाई. You just want to know if your doctor has asthma. You are pretty sure that she has asthma because of her symptoms and because your spouse had it as a child. तो आप बताओगे मेरे स्पाउस को भी हुआ था, ये हुआ था. तो तब आपको बताना है कि नहीं नहीं, डोंट फील लाइक दैट. It is a kind of a situation that can happen, but it might not be asthma, so only doctor can diagnose it. So you really hope that you do not need to wait for too long. So आपको कहना ही है you don't have to wait for too long. We have many doctors and we are not too busy today, so you don't have to wait for too long. Then say you will go back to the waiting room and you will wait for your doctor. तो ये patient आपको बोलेगा तो आप कहोगे don't worry, you can of course you can sit at the waiting room and we will call you immediately. So that is how you execute your task. 5 minutes easily get over. So normally when we give you the speaking task, sometimes tasks do not have enough information. तो आपको लगता है कि टास्क में इनफ इंफॉर्मेशन नहीं है, तो इसका मतलब कि आपके 3 और 4 मिनट्स पूरे होते हैं. लेकिन अगर आप 3 और 4 मिनट्स अच्छे से बोलते हो तो दैट इज वेरी गुड. लेकिन पेपर में आपको इतना बड़ा टास्क आएगा, इट वुड बी दैट बिग ऑफ अ टास्क दैट विल कम. दैट इज व्हाई आई हैव एडेड दीज टास्क इन योर नॉर्मल क्लासेस एज वेल, ताकि आप ऐसे टास्क कर सको कि आपको बहुत इंफॉर्मेशन मिलती है. So don't worry about the timing, just focus on how to speak. The better you speak, the better marks you get. So this is Dr. Bhupesh from Dr. BKM Institutes telling you about the OET speaking for nurses, and doctor will have the same kind of speaking as well that we will discuss now. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.